McCarthy.
Thank you, Chairman, and thank you, Leader. I'd like to commend my colleague, Senator Patricia Stevenson, on her initiative regarding 3 months free transport for victims of domestic abuse. And I'd also like to commend Minister Dara Khalil, who's the Social Protection Minister, for cooperating with her on that initiative. Cathaoirleach and Leader, I just want to mention Minister Dara Khalil, who's the Social Protection Minister, for cooperating with her on that initiative. Cathaoirleach and Leader, I just want to mention the matter of public concern, the health concern that was raised over the weekend regarding synthetic cannabis. A number of psychiatrists from Cork, Dublin and Galway, they wrote to the Irish Times, and they're calling on the government to act on the continued availability of HHC products, synthetic cannabinoids, that are designed to mimic the effects of cannabis. So despite the HHC being classified as an illegal substance under the Misuse of Drugs Act, the ban definitely is not working. The report that they presented shows that in psychiatric wards and in psychosis clinics that there's a lot linked to HHC and HHC-like products. And the reason is suppliers have simply changed their man-made cannabinoids with virtually identical properties, and that falls outside the specific ban. So the human cost, I know through people accessing the Tiglin services, etc., it's real. And a 2025 study in Galway found HHC was the second most commonly used drug amongst people presenting to hospital with psychosis over a 21-month period. So psychiatrists, they're not calling for a new legislation. They're just saying if we can use the present law smarter, in a smarter way. So, Cathaoirleach and Leader, I'm asking that the Minister of Health come into the House to address this at the earliest opportunity and outline what steps the government are taking to tackle what is happening in our A&E, and specifically how it applies to existing psychoactive substances, and how the legislation applies to these projects. I think it's causing very real harm to younger people. Thank you, Leader, and thank you, Cathaoirleach.